want to thank you all for coming out tonight to Northeastern's Innovation Campus here in Burlington. Thank you, Northeastern, for hosting this event here tonight. The Chamber works really hard to understand what the organizations are that are in the area, what their challenges are, their common challenges, and try to come to solutions. I'm very fortunate that in the circles that I'm in, I'm always surrounded by people much smarter than myself, and you're going to see that's on display here tonight. I do see there are some teachers here from the Burlington school system with future leaders here, so thank you for coming out tonight. We also have some town officials. I saw Melissa Tentacoulis with the Economic Development Office in Burlington. I also saw Caleb Zimmerman. Thank you for coming out tonight with the planning department. I'm going to keep it real short. And the Chief Information Officer from the Commonwealth of Massachusetts. Thank you.
You can wait. If I embarrass you.
There you go. So without any further ado, I would like to introduce our first moderator for the night, Chamber member, Dr. Dina Wassoff from CallaBio Solutions.
I have a few notes written down here so I don't forget my points. Good evening, everyone, and thank you so much for showing up tonight. It's wonderful to see such a cross-section of our community. We have biotech, we have business, we have technology, and academia. We are all here because we share a common goal: to explore how the convergence of AI and life sciences is reshaping discovery, development, and opportunity across our industry. Tonight marks the launch of our inaugural collaborative Fireside Chat series, hosted here at Northeastern University's Innovation Campus in Burlington, Massachusetts. This series brings together voices from across our region's innovation ecosystem to examine how AI is transforming the path from data to decision, from idea to impact, and from lab bench to patients. This series is co-led by CallaBio and Northeastern University in collaboration with Massachusetts Life Sciences Center and the Burlington Area Chamber of Commerce, organizations that together reflect the strength of Massachusetts' innovation and business ecosystem. At CallaBio, our focus is bridging the gap between emerging technologies and the realities of translational science and non-clinical development. This conversation, the first in our series, reflects the mission to catalyze collaboration that accelerates discovery, not in silos, but together. Tonight's dialogue will center on 4 themes. 1, the moment we're in, how this region is poised to lead this convergence. 2, the infrastructure of innovation, how data and talent, systems make progress possible. 3, collaboration as a competitive advantage, what partnership looks like and where friction points reside. And finally, the road ahead, how do we measure success in the next 5 years? Before we begin, there are a couple of housekeeping items. You'll see QR codes sprinkled everywhere. Like I said, this is the first of our many series, our many chats. We would love your feedback on content, and if you'd love to see someone conversing here, please make a suggestion. And 2, there will be a Q&A at the end. We encourage questions, insights, and we'll also be lingering if we run out of time. Please come up and let's have a conversation. And now I'm honored to be co-moderating this discussion with Dr. Jared Auclair, who has been instrumental in shaping this initiative. Dr. Auclair is the Dean of the College of Professional Studies and the Director of Bioinnovation and Partnerships at Northeastern University. Jared will now share a few thoughts from Northeastern's perspective and announce our guests. Jared?
Thanks, Dina. Well, good afternoon, evening, everyone. Welcome. I'm the opening act before the main attraction. So great to be here and to welcome you to our Innovation Campus in Burlington, Massachusetts, a 14-acre campus that we've had in the university for since the 60s. That's really about innovation and partnership driving prototypes to the market. Yes, in the life sciences, my lab is actually here, but across the board in quantum, security, cybersecurity, and other security type activities. So we're excited to have you here. I'd like to share too much information. So this used to be an old military base. So front of this, on the left here, in front of the building and in the parking lot in the chain link fence are the missile launch pads that are underground. So that is there. Great to repurpose this space. I think fundamental to my belief in education and in the ecosystems of Massachusetts, we have an opportunity to lead in our individual sectors, but in a more collaborative and integrated way, which is why I'm so excited to have with us this evening Kirk Taylor, the CEO of the Mass Life Sciences Center, a good friend and colleague since he took over, and we'll have them do a more comprehensive introduction of themselves when they come on the stage. And Carolyn Kirk, the CEO of the MassTech Collaborative. For all of you here, and specifically for Carolyn, once you're in Jared's orbit, Kirk, right, you never leave it. So be warned. So we're excited to have them both here tonight to talk about their collaborative efforts in the ecosystem related to AI and the life sciences and how that's going to materialize over the coming years, because both of those are fundamental cornerstones to the state's economic development and growth, and in particular in the region of Burlington, which I think is also the greater region of Burlington, which is well poised with local industry and government to really help drive that narrative, which is also why I spent some time here. Anybody watch The Big Bang Theory? I started rewatching it, so I'm on season 3, which is where Farrah Fowler comes into Sheldon's life, and they're shamey. So tonight we have Carolyn, Kirk, Taylor with us. And you put their Kirks on top of each other. So with that, I'll invite you both to the stage. And they're going to converse with each other. So we're going to do less moderating and more listening to, eavesdropping into the conversation they might be having at the bar or the coffee house. So with that.
Thank you, Jared.
Thank you.
Yes.
Yeah, that's good. Hello, Carolyn. We've been playing this. Thank you, Jared, and thank you, Northeastern, for the hospitality, as usual, to bring everyone together. This is critical. This is a pivotal conversation. I look at Carolyn because she's leading the AI Hub, which is a phenomenal advancement that the government assigned into being. So thank you for that.
You're welcome.
But we'd like to introduce.
Yeah, I'm Carolyn Kirk. I'm the CEO of MassTech Collaborative, so I am Kirk's counterpart in our quasi-economic development agencies under the Executive Office of Economic Development. We have 7 divisions focused across a whole spectrum of tech. So microelectronics, cybersecurity, digital health, AI Hub, that is our latest division that has been stood up. And so we galvanize the ecosystem in those different tech areas. And there's a lot of crossover. So in the AI Hub, even though it's housed with MassTech Collaborative, and I'll talk about what that is a little bit later, we work in partnership with our pals in life sciences, because so much of what can be learned and discovered with AI is in the realm of life sciences. But I'll have some other examples as well.
I think you also have a division on advanced manufacturing that's prime for collaboration in
Yes.
biomanufacturing.
Yes, the Center for Advanced Manufacturing. There is a QR code linking to our website, so you can learn all about MassTech from that QR code.
Yeah, that's a great point about the QR code, so we have some information as well. And I think Carolyn would agree that the state, these are tax dollars doing this, and it's amazing work being done. So from MLSC, speaking for that, Massachusetts Life Sciences Center. So with that, we'd love to share more and make an awareness of what we're actually doing, because probably some people in the audience would benefit from our programs, and I'm sure from yours as well. So I'm Kirk Taylor. Yep, I'm the head of the Massachusetts Life Sciences Center, and I have a couple of colleagues here, and I want to thank them for coming to support, but also to talk to you afterwards and before. I'm a neurologist by training. I was in pharmaceutical medicine, I call it, for about 28 years, and then came over to the government side, the state side, in this quasi-agency. We are the economic development arm for the life sciences in the state of Massachusetts. We use innovation, we use partnerships, we use academics, we use basically all the resources in Massachusetts to make life and health better. And this is the #1 place, the #1 state in the union for good health.
Yes.
And we're going to continue that. And I know partnering with Carolyn with AI, which is now, people say it's the future, it's now. We've all been using it. We may just not realize it's something called algorithms. So anyway, we're a mighty team. We have 4 funding pillars and platforms, which I can go into a little bit later. But basically, we want to overall expand good health, because at the end of all of this is a patient, and patients are waiting. So with that, maybe I can start off with a question for you, Carolyn.
Okay.
The moment we are in, part 1, why is the state of Massachusetts so poised for leadership in AI?
Great, well, thank you for the question. And I just want to sort of characterize the moment that we are in. So you're a doctor, I'm going to be the patient right now.
Okay.
I have an Oura ring that is tracking my sleep. I have an eGym wristband that tracks my workouts. I have an Apple Watch that basically let me know that my heart was dangerously low. And I have a pacemaker that right now, as we speak, is transmitting data to the app that I have on my phone and sending that up to the clinic continuously. So all those examples, those are all powered by AI, every single one of those devices. And if you could imagine, and that's just on basically the digital health side of the equation, and those are singular applications. And when we think about AI, we think about big AI and little AI or narrow AI. And narrow AI is any one of those instances. And if you were to translate all of that to an industry setting, instead of an Oura ring, you might have AI powering fire detection in a manufacturing plant. Instead of a workout tracker, you might have AI continuously learning your operations for continuous improvement. My workout tracker tells me how strong I'm getting, and it will recalibrate and give me more weight. And when I tap in, it tells me what I need to do, and it is setting the weights for me automatically. So imagine that application in learning continuously in an operation where it can make improvements. And instead of an Apple Watch, maybe we're powering quality control in a lab as an AI device tracking mechanism. And maybe the pacemaker is really a robot, I don't know. But every single one of these examples, whether it's personal, digital health, or in an industry setting, those all represent jobs. Those are mechanical engineers for the devices. They are the electrical engineers. They're the data scientists. It's all manufacturing that these devices need to be made. It is optimizing, it's bringing these tools into a business and optimizing for efficiency. Just like everything that I have on me is optimizing me for human performance and aging well, then it's the same thing that is occurring in business. I would say that we are at inning 2, Dina, would you say?
Yeah.
Of the AI transformation in the moment that we are in right now. So this is a very long way of answering your question, Kirk, of why will Massachusetts lead in AI? And Massachusetts will lead in applied AI. In other words, if we lead in life sciences, we need to be leading in AI for life sciences. If we lead in advanced manufacturing, we need to be leading in AI for advanced manufacturing, or robotics, or digital health. And so the lane that Massachusetts is carving for itself is world leadership. Can I say that?
You can say that.
Yes, in applied AI. And with that, Kirk, I would ask you, just drill down on that for life sciences. Why is Massachusetts positioned to lead in life sciences?
Maybe before you do that, Kirk, I can interject, and maybe Carolyn, you can tell for some of the audience who doesn't think about AI very often. Most people, when they think about AI, are thinking about ChatGPT. A lot of the examples you mentioned seem like agentic AI or AI with agency. So it would really be great to sort of level set the definition, perhaps.
Yeah, so that's a good point. So super searches, right? You can't go on your phone right now on Google without it giving you the AI definition of whatever it was. So really sophisticated searches. And then there's power prompts. That's the ChatGPT. And you go in, and those are really sophisticated. I met a guy who was making a robot for a lake to chase geese. And he got these pieces, and so he couldn't figure out the instructions. So we went into ChatGPT and got powered through the software to get this thing going, to get his robot working to chase the geese on the lake. But it was a very sophisticated set of prompts that he was using, but using that ChatGPT, I use it for like, tell me where to go in Italy for 7 days. But so it's that whole spectrum.
You know what I use it for? I ask it to give me building instructions for Legos with the pieces I have laying around my house.
It's that progression. It's the searches, it's the prompts, it's the narrow AI, meaning those single applications, and then there's the big AI, which is really the fully integrated systems. And Amazon Robotics is a great example of that. Auto manufacturers are fantastic examples where all of those individual devices, or your tools on AI roll up into some networked, solution that can pull it all together. So it's a huge spectrum. And there's 6,000 manufacturers in Massachusetts. Very few of them have adopted much by the way of AI because they don't have the data. We're going to talk about that a little bit later.
Yep, absolutely, and just before I dive into why we're well positioned for life science and AI in Massachusetts, the manufacturing part, everyone knows Massachusetts is the country, if not the world leader in biotech, in the life sciences, but we're also really, really good at biomanufacturing, and we're expanding that, and certainly one of the programs we have called BioBoost is looking at medtech as well as biomanufacturing, just putting that out there, and I know that underscores what you just said. Yeah, so in terms of why we're well positioned, first of all, is talent. And when you talk to Texas and California colleagues there, in Virginia and there, North Carolina, and certainly they're building up their life sciences system, they don't have the talent that we have. And over 500,000 students come every year, to Massachusetts to study. A lot of them stay. But then we also have the docs, the postdocs, we have the professors, we have people from around the world who come. That talent is critical for innovation as well as cooperation. Probably what we'll say, both of us, multiple times during the course of the night is the C word, collaboration. That's the secret sauce. MIT talks to Harvard, talks to BU, talks to Northeastern, talks to Middlesex. When people are talking, they're collaborating. Now there's proprietary information that can't be shared, but that's not the point. Because we also have shared core services and core machinery and resources that we can talk about. And we'll get to that a little bit later on. The other thing is the universities, the high density universities. I mean, we're not talking, again, just MIT and Harvard, but the 2-year, the 4-year, the public, the fact that community colleges are now free. All of this stimulates young minds and older minds to say, I can go to do this, I can think it through, and beyond the ChatGPT, I can actually go learn this, maybe get a degree in it, a certificate, and get back. The other thing is VC money. I know there's a lot of talk about there's not capital funding. There still is funding. And every once in a while, you hear about a very big deal that went through because something hit. We're in an interesting time. There's some federal headwinds, there's some uncertainty and insecurity, but it's still here and it's still happening. And I know that because I talk to these people. And what maybe used to be needed for that type of deal, we need something else, but we haven't. And we shouldn't ignore that.
The other thing I think would be interesting from your background as a neurologist, basically, is, in the life sciences plus AI, we also have, I would argue, some of the best hospitals, because you talk about cures in patients. We can't do anything if we don't have those also.
Yeah, the hospitals, the academic hospitals, you're tripping over the world of experts here, it may be hard to get a first-time visit, we won't go into that, but, with the specialists, but nonetheless, some of the, if not the best hospitals are right here. And those hospitals are collaborating with biotech, those hospitals are collaborating with entrepreneurs, those hospitals are collaborating with VC and the other academic institutions to create therapies, to create breakthroughs, to create different treatments that will take us to the next level. And fourth thing, one of the things Jared's working on with us at MLSC, we have these 4 advisory groups, just areas we're really interested in: cures, No longer should we have to take a pill for 20, 30 years, like I do for Lipitor, you're talking about. I continue doing 25 years of contact, Dean about it, as well as Dean Harris. That should end. My family knows we have the high cholesterol gene, so let's fix it. And not have the rest of my relatives forever and ever be taking pills for 30 years. Mental health, we know that the life science, right here, psychedelics, things we're using, visual reality. It's not just the SSRIs or SNRIs, which are great, or pills to treat this anymore. We have ways and new ideas, as well as technology, partnering with Carolyn's group on treating these things. Preventative, personalized. I mean, if that's not what cancer treatments are right now, I don't know what is with targeted therapy. How do we actually reach what you need? Because your treatment is not the same as your treatment. And that sounds logical, but yet we're giving the same drug, which isn't bad, but it's just not optimal, right? So using machine learning, using avatars, and we'll get into that later, how to do all of that. So, yeah, it's...
And you're collecting all that data from Carolyn off all of her devices.
Right now, things are tipping, back at the lab.
I'm a walking data center. I admit it.
But with that, and that's an easy funding. We have the talent, we have the academics, we have it all here, which is what I think we'll lead. And with that, I know both of us enjoy, and we do it a lot, like today, we travel the state. We travel the state to look at what's happening. Genius on every corner. I'm not getting it like Florence. Genius on every corner happening here in the state. What are some examples of some local companies that you've seen that are really showing this incredible innovative impact in AI?
Well, I'll mercilessly stroke Jared and Dave Bussey's egos right now, using Northeastern as the example. So we ran what we called an AI Models Challenge, which was a call for models that need to be developed using data to solve big problems. And the challenge, part of it was getting the data, and which is the AI is a voracious consumer of data, and it's only as good as the data that it has. So we said, what are the problems you're trying to solve, and how are you going to go about getting that data? So Northeastern came into the challenge program, and they're piloting basically a dynamic solution for coastal resiliency. So I was the mayor of Gloucester, and during Hurricane Sandy at the time, and so I know the vulnerabilities that our coastal community, there's 78 coastal communities in Massachusetts that we face, and vulnerability plans for coastal resilience, they're static. You get a consultant, you do the plan, and then things change. So Northeastern is piloting it, I think in Woods Hole and somewhere else on the South Shore.
Marshfield.
You
know why it's super important to link to Gloucester? So Gloucester has the Gloucester Marine and Genomics Institute.
That's right.
And the Atlantic Resiliency Innovation Institute is modeling all of their work after GMGI that's working with Jim Chen on the project that you're describing.
That's fantastic.
6 degrees of separation. Right
Yep.
there.
But you need. What are we going to do with the information once we get it? That can be driven out of the model. I don't know, but it is a problem that does need to be addressed and solved, and we're collaborating on. These are the blind spots we have as a municipality, as a coastal community. Help us figure that out, and this is the beauty of AI: is you don't know what you're going to find out. You really don't. It's discovering what is yet to be discovered, which is why those examples, Kirk, that you gave are so powerful. We can't necessarily imagine a world where we have custom treatment for a cancer instead of just, sort of bodies of drugs for certain categories of people.
I think you said one thing too that I just want to emphasize for the crowd on purpose. You're quasi-states that fund, but you're not only funders, and I work with Kirk a lot, and others work with MTC. Like, you're partners in the journey, which is also super exciting to all of us who engage in the ecosystem.
Well, and I think part of our requirement, when we work with the university, who are your industry partners? So Dina, who's running a company, get to the table. These aren't academic, necessarily purist exercises in terms of state dollars, because these are economic development programs. We are trying to drive jobs. We are trying to drive startups. We are trying to drive growth and attraction to Massachusetts. So partnership is super important in the programs that we run.
You know, just to really quickly build on that, absolutely, that our tax dollars, fund MLSC and the other quasis, yet we can't fill the gap we know that's already present. You can't fill $1.3 billion cut in NIH funding overnight or even a year. It's not our budget. But what we can do is fund some of it, right, through tax dollars and attract other dollars. Like we have a program called Massachusetts Next Generation for our entrepreneurs. So less than $3 million over the last, since 2018, have been invested there in young entrepreneurs, people early in business, early in career, around services. But over $300 million of follow-on funding has occurred. This happens because of industry partnerships and people saying, well, wow, look at this good work. And wow, if the MLSC has done this and states behind it, why don't we get behind it too? And that's the quasi-pub, that's the secret sauce of the private public, that we combine our funds so you cobble together and 2 + 2 can equal 4.
And if I can give the biotech perspective, the valley of death in biotech is when you have a good idea and it's not funded. And having these small programs really help get companies to the next milestone.
Absolutely. Yes, I think
We
with that, we're
go to the
transitioning.
next phase.
Yeah, fun, we transition.
So I think,
Yes, so the next one is, let's talk about the infrastructure of innovation here and how data systems and talent make progress possible.
All right, so Kirk, I'm going to toss that one over to you. And you mentioned that, NSF funding and but we have within our control ability to impact outcomes. So what does it take, technically, culturally, institutionally, to sustain the innovation that we are really just on the cusp of realizing in AI and life sciences?
that's a key question, obviously. And technically speaking, you need talented people, but trained people, right? And I know one of the fears that people have right now is AI is going to kill jobs, take away jobs. In my opinion, I'm borrowing this from someone else's. AI will take away jobs from people who don't use AI. If that registers, you have to get with it and you'll be in it. I mean, we've had these technological revolutions before in history, and especially in this country during the century. It will happen, but we'll partner with it and survive it. So data scientists, we need technically trained data scientists to analyze, to take the data that's coming before you right now, to analyze that and say, what does it mean? Because with that, if we not so much cobble together, but if we analyze a large cross-section, a representative section of this state even, we can then kind of predict what will happen if a person of a certain age, person of a certain height, certain person background, person of a certain phenotype will have a disease, will have a pacemaker. What does that person need? We don't have to wait till that happens, And these are the avatars, these are the digital twins that are already in use. And maybe then the influencing of the guidelines. Because when all of us go to the doctors, they're using guidelines to actually treat us. And everyone knows about the PSA and prostate cancer and how that's evolved over the years, But that's important because you don't want to miss something. We have enough data out there, if we mine it correctly, using like what you're doing, to actually make a difference. Institutionally, we've talked about the buildings of the universities and the hospitals, but also the nonprofits. There are nonprofits out there making a big difference. I know MLSC certainly has a lot of grants or programs targeting nonprofits who can then partner with industry, and that's, again, the secret sauce. There's one word that I don't know if you guys know called incubators, and Lab Central is one of them. There's several others across the state. These are brilliant models where you have a center like this, let's say, you carve it up into lab space, and you have someone who says, I have a great idea and I can't quite do it in my garage anymore. So they, through funding and support, are able to get a lab space, a bench, 1 bench, 2 benches, and able to take this into reality. And I like to say the path is garage to lab, lab to clinic, clinic to agency, and agency to patient. And that's a life cycle. And we certainly do it here.
And you have a really great example of an incubator at MBI out in Worcester, the 15th largest life sciences hub in the country.
All by itself. That's a great point, Jared, and that's why we love Boston, we love Cambridge, but life sciences here in Massachusetts is more than that. Again, my phrase, you've heard this for Dr. Carolyn, so there's some people on my team. I like to say from the Berkshires to the Cape and from Gloucester to Woodshall and everything in between.
Gloucester.
I knew he was going to do it. I'm going to say Gloucester. I'm going to say that. You were a terrific mayor, so I'm going to say that. But yeah, and everything in between. And I'm not joking because I've seen these centers. You go, and it's like, this is amazing, genius level science, and I just want to shout it. I'm saying that everyone should know in the country that this work is happening right here in Massachusetts.
That's right. Didn't I see Carolyn at the BIC in the Berkshires a couple days ago?
Recently.
Yeah, we, on behalf of Governor Healy and Lieutenant Governor Driscoll, announced $15 million, I think, in funding for what we call the Tech Hubs program. And MBI in Worcester received, I think, about $5 million. And the BIC also, for a different tech hub, it was for their optics program out there, and they partner with industry, and there's a whole supply chain around quantum computing, of which that will become a big part.
And the BIC is the Berkshire Innovation Center.
The big,
Yeah.
That's amazing.
And then Woods Hole also, New Bedford also won a Tech Hub award. And then there were some other strategy grants and also designations, if you could demonstrate in your local community. And I encourage folks here who are tied into your local community economic development areas to look for our next Tech Hub solicitation.
Before I try to get back over, Carolyn asked to sort of flip the script, and answer her question, I did want to finish answering in terms of culturally. Culturally, it's important because we're all different cultures, and we hear information differently, and we feel differently, and we need different things in order to feel valued, in order to feel heard by our doctors. That just can't be underscored enough, because two people can walk in the same doctor's office and walk up with completely different impressions about whether the doctor's good, they work great. People need to understand one another. And with that, that's feeling of inclusion. And the only way we'll know that is by decentralized trials, using devices, allowing people who work 2 and 3 jobs or can't make all these appointments at the clinical centers to use wearables, what you're doing right now, to use those devices so that that data can be collected, it can be analyzed, and we could use that and publish it for actual clinical trials.
Sounds like another collaboration, the cybersecurity of the data.
Oh my goodness, cybersecurity, well, that's a whole other conference, but But with that, so collaboratively and culturally, I have to underscore that we have to celebrate our differences, but we also have to understand them. I remember when I was at Pfizer, you couldn't go to Japan, like I was doing global work, and we'd go to Japan. You could not go until you went through cultural training. So they basically, you sat down, you learned where to sit at a meeting room, how to use the blackboard, chopstick, the whole 9 yards, because you didn't want to insult your host, nor did you want to embarrass the company. Now, I don't know if we need to go to that extent with everyone in the room, but you see that this is already happened, this is years ago. From the AI infrastructure side, you said some things, but what is this intersection and how is this sustainable?
Well, so and Dina, you made a good point about there are public dollars that can go in to where other dollars just won't go. You won't get the private dollars, you won't get the venture, you won't get private equity. And so the Commonwealth takes some bets on what the next big economic driver is going to be. Governor Healy stood up the Massachusetts AI Hub and was authorized by the legislature for $100 million in the Mass Leads Act, which was the last economic development bill that was passed. And there was a whole bunch of things that went into the blueprint for the AI Hub. There was multiple working groups over months and months and months of convenings coming together saying, what does this thing need to be for Massachusetts? What does that infrastructure look like? And there are basically 5 pillars. So I'm going to just go through them. One was ethical and responsible AI use. So this is just a core principle, core value that we have. And then the translation into the hub is we are not getting caught up in all the bad things that are happening with AI. We are policy implementers, we're not policy makers, so we look to our friends in the legislature to establish policies around the use of AI. So our premise is we are focused on the ethical and responsible use of AI and getting that implemented in really powerful ways. One very physical piece of infrastructure is compute power. AI needs compute power. So the governor has announced a $31 million investment in the Massachusetts Green High Performance Computing Center out in Holyoke, Massachusetts. And that is a giant data center that will is currently in use. It's been around for about 12 years, and multiple universities tie into that to get certain compute power. This will be amplified even further to accommodate the needs of AI, not only for the universities, but also as an entry point for startups to come in. If they have data sets and they need the compute power, some allocation of that will be set aside for startups, and for other academics. The third piece is data commons. A data commons is being set up, and our partners at EATS have been phenomenal with us on this together, and really unlocking public data sets that are available, that are anonymized, so that if you want to test your hypotheses or your algorithms, you have data to actually work with. One thing the AI Hub is doing is we're downloading all of the data that we can from the CDC in the event that it disappears. And a lot of people are doing this because those data sets are currently available, and they are very, very robust. So we are trying to.
You'll get new data sets from MLSC's Biobank program.
That's right.
Yeah.
I'll talk about that, absolutely,
Yeah.
it's huge, thank you.
The fourth is the AI-focused startups. I talked about that, and then talent workforce is a really big deal. I also I need to give a shout out to our Burlington High School students that are here. So, over this past summer, we held an AI summer camp, right? And we paid students, we paid you, right? We paid you, yes.
Of course they're gonna say yes.
Well, so here's the challenge. This is the very practical challenge. A lot of kids have to work during the summer, and if you want to bring them into these careers, they're gonna work at night and do the summer camp in the day for AI? Some of them, maybe, yeah. But we wanted to provide that incentive for the students to be able to focus, and because you're competing for hearts and minds. People are, well, should I go into cybersecurity? Should I go into robotics? Should I go into AI? I don't know. The tech and innovation sectors are so profound and robust right now in the era that we live in, and so we are competing for hearts and minds. So I hope we won your heart and your mind to pursue a career in AI.
Well, the other beautiful thing it does, though, right, is that in high school, I'm not speaking for your experience, but I didn't know what career opportunities existed outside of like biology as a life scientist, biology, chemistry, and physics, right? Like giving them the opportunity to really experience what those careers might look like is so important.
Yeah. So many folks say now, oh, the young folks are so overloaded with information, but they're also overloaded or loaded with opportunities, because when I talk to young people in my family, they tell me what they're majoring in. I'm like, what? Most of the time they have to describe it in detail. I won't say I regret, but say, would it have been nice to have some of those opportunities when we were in college? Maybe. But we had more than our parents did. It's just cumulative and it builds upon itself. So, it's hats off to that.
And I would say that for a young generation, to know what you don't want to do is just as valuable.
Exactly.
I know so many people that went all the way through PhD programs only to realize that this is not what they want to do. So it's valuable on every front.
Can I say?
Yeah, go ahead.
No, I was just going to say one thing, and I sort of touched on it a little bit, and that is right now, I'm hearing out because of UMass Law, I talked to the Chancellor of UMass Boston even, and other institutions, and they're saying that, and UMass Chan, they're saying that they are seeing a number of postdocs or pre-docs saying, maybe I shouldn't do this, because of unfortunately the negativity and the lack of the drop in postdoc places, and actually people being able to finish their research. They're wondering, should I go into this? And of course the answer is, oh my goodness, yes. But we have to then offer them the solution and to step in and the support. And our center at New York Center, we're trying to do that, certainly with the high school.
That's also why we fundamentally support the DRIVE initiative for all politicians around.
That's right.
Elected officials.
Elected officials, that's right, yes. We talked about that last time, yes.
No, absolutely, we gotta do it. There's plenty of seed out there, but I think Carolyn,
Yeah, so I want to go back to the data piece, because that is so important. One of the other examples that we had for our data models challenge was, if you think about, and this is another municipal example, waste, landfills, things that get picked up, you take it for granted, the truck comes by, off it goes. And the sorting that has to take place is so that you can do the proper reuse, recycle, as opposed to it all going into the incinerator. One of the projects that came in was a visual system that the camera could watch the picker person separate the very minute mountains and mountains of recycling, for example. And so that the tin went this way, and the plastic went that way, and the paper went. If you have single stream recycling, you know what I'm talking about. You just put it all in one bin, and someone's got to undo that. And so there's no data out there that allows you to know what can go where. And so this example that is being developed, I think with WPI, is to have the visual data collected about what pieces to help with that sorting process down the road. So that the humans in the loop are used at a higher capacity rather than just the picking and sorting, because the landfill problem is a problem. If you were part of the Republic strike and they didn't come and get your garbage, what did you do? You put it in your car and you had
No, I posted on Facebook and was like, why aren't you picking up my trash?
I know, exactly. But anyway, back to life sciences. So Kirk, what kind of data do you need to have access to for solving those life sciences problems?
I won't cover it all because it's voluminous. I mean, if you could think of a data topic, we need it. And starting at the genetic, I just mentioned, so we know the gene of hypercholesterolemia is in my family. So genetic data. We need then preclinical data, animal model data, but not just animal model, virtual animal model. It doesn't have to be living tissue because again, you could use machine learning, you can use AI, you can use algorithms.
Lab on a chip.
Yeah, exactly.
Or organ on a chip.
Organoids and everything, to actually predict what you can do to save money, to save living tissue, and then go into the live animal models. And then of course clinical data. You need translational data going from the lab into a person and figuring out, okay, but not doing that whimsically or not doing that without a lot of machine learning, without a lot of AI support, so that you're saving money, you're saving time, but you're also not wasting people's money.
I'm going to put you on the spot for a second, because the data you need is voluminous. One of the things that I think is really interesting, I was in Washington before the government shut down.
The what?
Yeah, right. And talking about the future of the data that the life sciences needs to be competitive, right? And the theme that resonated through that conversation was only about genomics data. And I think we as a state, we as a country, we as a people really need to think beyond just genes and really think about proteins and metabolites and other things also.
I was going to say proteomics, metabolomics, omics, absolutely. To say, okay, what structures are actually going to work here? If we layer up the structures, which is already happening, so that this high screening previously, that accelerated development, but it's even better, where you can go in the computer, you can spin around a molecule, change the receptor site, or say, okay, well, this folding actually makes it more safe, it makes it more efficacious, so we know that it's going to fit better into the target. That type of thing is happening right now, we need more of it, so absolutely. The microbiome, hasn't gone away, it's still very important, the gut-brain axis, the gut-chase axis, the immunology of it all, and the immunology of it all. We're using immunological products and T-cell products for migraine. We're using immunologics and injectables for diseases we didn't think were. We're using CAR-T now, potentially for lupus, for cell therapy. This is all very important. A little sidetrack for cell therapy. We know several companies have now said they're not going to go into cell therapy and gene therapy. Okay, it's a business decision. But those are great platforms that can create cures and already have. The cure for sickle cell currently came from that line. CRISPR comes from that line. So we can't give up on it. Granted, I'm not running those companies, and I know they have business decisions, that's not the point. But we have to also support it from a people, from a patient, from an advocacy level. One other thing that I move on to is outcomes or usage data. That's very important. So you took the pill. So what? So, well, I'm looking at one. The usage data. The information that's happening right now. What does it mean? Is she feeling better? Is she feeling worse? Is there a particular moment in her day that this particular thing happened? Did she do something, eat something? All of that is critical because it's not just Carolyn Kirk. She's representing a bunch of people. And then she's not representing a bunch of people. There's Carolyn Kirk Prime, there's Betty, there's Sam. When we put all that together, then we better understand, again, the targeted therapies, preventative, personalized, how we're able to look at a bunch of people using different data sets, but we need those data sets. For years, we've been mining the electronic data records and also insurance records. Wonderful, but that's not enough, and we're able to do more now.
Those are also good examples of why AI needs good data, coverage in, coverage out.
Absolutely, and I'll let up last thing there. We're all aware of this because most of us stream something on our televisions, and we all know, or even if you put on your phone, you wonder why you said hairspray, and tomorrow you have 4 ads in your phone for hairspray. All right, so listen, we know that. But the algorithm is targeting, the supervised algorithm saying, okay, well, there's certain aspects of this person's life that we need to follow. Netflix, why do you get certain, if you're on Netflix or Hulu, why do you get certain movies or shows recommended for you? That's the algorithm. And that's machine learning, that's AI already in motion. Picking, saying what your age, what you do, what you like, and that's part of what's happening. Let's take that to life sciences. And we already are, but we need more. I think with that, we may go into our point 3, we're going to transition.
We should transition, yes.
Yeah.
Maybe we can do point 3 super fast and 4 so we can take a few minutes for questions.
I'm happy to go right to 4.
Yeah,
All right, let's go straight to 4.
I'm hearing.
What's the road ahead? Is
The
my
lights
question
are
today.
off soon, I'm hearing.
No, I want to give it, I don't want like 50 girl line, but that would be selfish of me. But I do want to give the opportunity to the audience for a couple questions.
Yep, so one quick, so point 4, the road ahead. So we know that it takes, we've been saying it multiple times, it can't be just me, it can't be just Carolyn, it can't be academics, it can't be hustle, it has to be a collaborative effort, right? So what will AI Life Science Collaborative success look like? Now listen, we get everything we want to, but what does success look like in your world?
Thanks, Kirk. So it's beyond life sciences, for sure. And I think, I'm going to pop over to another analogy, and this is in the defense industry. So we have a $100 million contract with what is now need to be known as the Department of War. And we, part of what we do for the dollars is to run a hub, and then we respond to calls for projects where the department will put out, this is the problem we're trying to solve. And and this funding has not been cut, and this funding is continuing.
That's because we like war.
I didn't want to go there.
I'm under contract, so they made us change all the words. And those were a couple of the words that we had to change. But, so the requirement is, it's a forced collaboration. So we have a hub, we have members, we have a project call, we have to bring in academics, startups, the primes, which are the big defense contractors, the supply chain, and come together for the best proposal to solve that problem that they're trying to solve. And we kind of do this already, but this is a highly structured process to drive out innovation. So it's the collision of ideas, it's the collision of different points of view. And our hub has won the most number of projects. There are 8 hubs in the country. We competed against 80 hubs in order to win the hub that we got. And so that is a really successful model. And I know this because we are actually bringing to market solutions for the department for our national and actually economic security. So that's just a quick example of what it looks like in the defense industry. But what does it look like in AI? I mean, in life sciences. Sorry.
No, I totally get it. I'm loving the example that you gave. Success looks like faster development times. Why does it take 15, 20 years, 30 years sometimes to bring that idea to market? And why does it take $1 billion, $2 billion? With the models I just said, where you're not using live, you're using machines, you're turning around your proteome, you're using all the data that you just described going into the system. Why can't we decrease that time? Why can't we decrease the cost?
We had a huge innovation in that space coming out of David Baker's lab in California of modeling monoclonal antibodies that was published in Nature just Monday, I think.
Exactly, and monoclonal antibodies have been 10, 15 years now, maybe 20 after 20, think about it, because of FNX and the other drugs, multiple sclerosis. Fantastic, but we need to do it faster, we need to do it better. We have a blockbuster drug come through, and there's like, wait, there's another one coming. Is that better or bigger? Should we wait? Should we not? All of that I think should be done in short amounts of time. All this gets to that personalized preventative medicine, which I've said a number of times, that having better access there, having more cures, having more tailored therapies, having where we don't let you get the disease, we prevent you from having the disease. Everyone knows now that the ApoE4 gene is somewhat, well, not somewhat, but it's significant and probably a higher marker in Alzheimer's and homozygous, 2 copies of it, much more so. It doesn't mean 100% you're going to get it, but if you do have it, then what, do you live with that knowledge and nothing? Or is there a way of targeting what you can do with biomarkers, you personally, in order to have a better quality of life? Because who wants to live with that fear, right? Once you test it, you know it. What are you going to do with it?
Do you think that both of you suppose you could both take your approach to this question? But thinking about that in particular, I wonder if AI doesn't sort of democratize the patient's ability to own their own data and be more responsible for their own health care.
I would agree with the second part, not the first part. I've surrendered my data, it's just out there in the world. And
oh yeah, good point. I didn't mean
right, exactly. No, it's but in terms of taking control of your health, my Apple Watch literally saved my life because it was recording very dangerously low. In the past, that would be called sudden death syndrome, right? Where you don't know that this is happening to you and you die, And so my Apple Watch was acting up. I called my doctor. She's like, wear this little Zeo patch, which was, I wore for 7 days. It captured 800,000 heartbeats. That was read by a company, I don't know, in the Midwest, and the human in the loop called, after they saw the results, and said, get her to the ER. She needs to be in the ER right now. That cycle, I am a huge proponent of the frontiers for problem solving, for health, for aging well, for longevity, for human performance, translated right over into our business environment. While all those same lessons 100% apply in life sciences and business operations. And that's, they say that the stock market right now is doing so well because of AI. There's going to be a big crash. I'm like, I don't know. We're in the second inning here. There's a long, long way to go for the optimization of AI.
And Carolyn, to your point, for clinical trials, it's now being used, and I think it's going to continue to be used, monitoring of patients, remote monitoring of patients.
100%.
And that's extremely data rich, and that goes to the success of clinical trials, which is we have a high failure rate in the development of drugs here. So another success could be an increased or decreased failure rate for any trial.
Excellent point, because when I started, again, I did Pfizer 25 years ago, it was said back then you didn't fail in phase 3. For those who know drug development, in phase 0, then in phase 1, into human, phase 2, safety, mostly. Phase 3 is safety and efficacy, big trials that you file to the agencies in the world and you get a license. You didn't fail in phase 2 because by that point you should have known your dose, you should have known your efficacy, you should have known safety, blah, 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 you should have known your size, your patient population. And now it's almost, I won't say routine, but too many times we're seeing big ticket items in companies failing big 3. You're absolutely right. If you can eliminate some of that by doing it virtually, with machine learning, the avatars and everything else, that would be huge. And then just building what Jared's question, of course, Carolyn's response. There has to be a sharing. And there has to be a thinking of other people along with your disease. What I mean by that is the data you're giving, to say it can help, it will help someone else. It can't just be, I'm in this for myself. And if we use that level of humanity and that perspective, I think it'll propel us even further. Because you know that, I'm going to turn my data over to the cloud or to the system, anonymized, but still, it's not good alone. it needs to be compiled, needs to be analyzed, needs to be shown with others. And I think that's one big success factor. And one thing I would say for the community perspective, which is how we should approach this in life sciences, we're all in this together. And if we start any isolationist policies there, we're going to fail. So we're all patients at some point.
Thank you. Well, now we'll open it up to the audience for Q&A, please.
Great conversation, by the way. So scientist by training, founder, but my question is more of a personal nature. And it has to do with data. Love the example you gave about the watch. I'm gonna have a child that's gonna get an RNS device pretty soon, responsive neurostimulation. And the conversation I had with the neurosurgeon about a week ago was, who owns the data? Do I have access to the data? And do I have live access to the data? And can I do whatever I want with the data? And the response was, what are you gonna do with it? Well, it's like, well, first of all, there's so many, my kid has seizures. So there are many, many triggers that, cause my kid to have seizures that, I can't walk into a doctor's office and say, you know what, my kid looked at, a certain frequency of light and it caused a seizure. So the ability to couple that data with an app that says, temperature, barometric pressure, speed if you're in a car, all these things are important to me. And I fear that I'm not gonna have access to that data, because the question was asked, will I have access to that data? And the answer was no. And the question was asked, who owns the data? And it's the company that has the device. So democratizing this stuff is great, but it's also important to give it back to the patient, and the parents to make these decisions and to go on and create an app that's personalized digital health. So what's the thinking around that?
I couldn't agree more, and I'm not surprised and surprised that there's companies saying you cannot have your own data, because 5-10 years ago we had this conversation where, let's take it up a notch. Let's say you went to a clinical site at Mass General, and Dr. Jones is your doctor. Dr. Jones is one of 30 doctors across the country doing that study. Dr. Jones would say, I want to have all the data from my site at Mass General because I'm going to do my own analysis. It took a little time, but after a while, that's already happening. My one point there, and I totally get where you come from, and I would advocate for that. I saw a lot of seizure patients, I did a lot of epilepsy work, and I feel for you, in your journey, is that it has to be collaborative. Because whereas you're probably bright enough to do everything you just said, there are people who take that data and then not quite get the right answer, or share the wrong answer, or share an answer that's not applicable somewhere else. So I think it has to be a collaborative effort between you and the study people, and as well as someone who can actually say, what does this data mean? I'm just concerned about making conclusions that may be specific again, and other people using it.
But also, this is our regulation.
I just want to follow up.
Yeah, go ahead.
And, it's not that there's no access to data, it's that you need to go and make an appointment with that specialist, that KOL, that, it takes 8 months to get an appointment and to get access to the data. And then you ask the question, well, my kid's on 4 anti-epileptics, and let's talk about exposure and drug-drug interactions. And then the neurologist looks at me saying, drug-drug interactions, what?
Okay, well,
Right?
I'll give you a name of a neurologist.
Now your name.
I did not my name, I don't see patients anymore. But yeah, that's, yeah.
The point is like the data, right? So like the patient needs to have access to their own data, and they should be able to draw their own conclusions. And I fear these companies will withhold the data.
Yeah. No, when I talk about my transmission, it's one way.
Right.
Like, I don't know what's transmitting right now, and I won't know for 3 months, because it'll be a check-in in 3 months, where they send a giant report, which I can't make heads or tail of. So some regulation is maybe appropriate in some of these instances. And certainly, I think it's the sophistication of the data that's available. Heart data's been around forever, right? So, but drug interaction data, not so much, because we've just looked at it maybe in silos. Or some other diseases, maybe there's just not as rich a data set to work with.
Yeah, I mean, it's those commercials that you see on television for Ozempic, we all love that song, right? And then it goes, and you can have blah. That's the fair balance that the agency insisted, or BDP insisted that be put into, because people were going to the doctor, give me this drug, but not all the patients who taking the drug were actually studied. So then new things are seen in phase 4 in the real world because you didn't know. So then effects have in drug-drug interactions. I would say, though, one other approach to the situation that you're saying is the informed consent. You had to sign an informed consent to do this. And this is where patient advocacy and advocacy groups really play a part. So whatever if you're having a disease, therapy, even pacemaker, find a patient advocacy group, because that force that they have is much more powerful than your singular voice. And they have power everywhere. And I would say, when you're looking at that informed consent, say, wait a minute. So you're saying that I don't have access or I can't do it. I would say, is there any way to do this or to figure this out? Because they have to listen. Because you're probably not the only patient or patient's family who said that. So those are two recommendations, patient advocacy, but also that informed consent could potentially be amended. I can't speak for the company why, but I hear what you're saying. You've come a long ways. I remember when absolutely not. You could do solo practice analyses of data. Absolutely not. That passed. We can do that now, but from a patient perspective. And you should, when you get your report, you should say, I have these questions. You know?
I use ChatGPT.
Yeah.
I literally put it in there. It's like, you're gonna be fine.
It's an interesting question too, and maybe complexity of data plays a role into it, because I have several friends who have children who are diabetics, and that data is fed in real time back to the parents.
Right.
Right.
Yeah, so
And
that's, yeah.
And it's your, not interrupting Carolyn, what you're saying are sugar levels, and heartbeats, the electrical activity. Okay, what does a spike mean? What does a spike in wave mean? What does a student form? What does a passing form? It can get a little bit. And then you've got to correlate it to stroke effects, like you were saying, light, diet, emotion, what's all happening there becomes quite complex. So.
Yeah, and it's also complex in the context of thinking about my mom. And she's going to get data back. Like, you will understand the data, right? And maybe I won't. And I'm going to all of a sudden be like, oh my God, I need to go to the doctor. I need to go do this. And then you're going to take WebMD to the next level, right? So there has to be a...
Exactly.
But I think we can take one more question, and then we'll be hanging around for a little bit. There's snacks, and we'll take 2 questions from the 2 Ricks and drinks. So we'll start with this Rick, and then we'll go to that Rick.
Could you possibly leave us with a positive thought regarding job growth in the life science industry in its usage of AI?
Yeah, 100%. I mean, like I said, AI will not take away jobs. AI will take away jobs if people don't use AI. So once you start using that, and all the ideas we just said, sort of created a couple of ideas. Informed consent writing, informed consent analysis, informed consent monitoring, how do we get patient training? Can we have professional development for people who want to train patients on how to read their own data? I'm just making that up. Well, why not, given what you just said, right? So there are other ideas, and it's not just with therapies, it's with devices. Actually using these things. When I was doing clinical trials in industry, we often employed nurses, especially when we had a device, because it's not just knowing the study, it's are you using the device appropriately? Are you holding it the right way? So we've been there before, and I'm not afraid of it, but I think people need to be willing to be retrained and to try new things, because it's out there. Did we know ChatGPT 7 years ago?
By the way, AI is a device. That's a whole other can of worms.
Right. So there's 6,000 manufacturers in Massachusetts. We have a division, the Center for Advanced Manufacturing, where we work with these manufacturers. You got to get in this game. You have to get in this game because all your competitors are. So it's that upskilling, that reskilling, it's that adoption of AI to remain competitive. So it's as much a job protection and strategy as it is growth strategy.
Do you think so I went to a meeting, not in this state, and a manufacturer said to me and a group of us, we'll never use AI, we'll never use robotics, we're never going to change, we're going to do it the same way, we've always done it, and stop talking to me. Do we have that experience here?
Absolutely. It's hard. Some of these manufacturers, their data is literally in a notebook. And so to improve a process, to use their data to improve a process, they got to extract it from the notebook, get it into some tool, and then, so we provide a lot of support in this way. So that's a lot of fear-driven and upheaval inside your organization that
But the one thing that's really interesting from that context, in my estimation, you can tell me if I'm wrong, the upcoming workforce are going to be native in AI and data and robotics, but they're not going to want to work for you if you're not deploying those technologies.
That's exactly.
Totally agree.
A 3-year-old who runs an iPad. I mean, it's.
Yeah, my kids teach me how to use my technology.
Yeah, it's a basic interest. So exactly, and that's to your point. Yes, I think earlier generations, a little bit of that, or younger generation, are already in the system because they've already where they know what ChatGPT is. At age 6, they've been already plugging into it. So I totally hear that.
And Jared, your point there, it's also, I've heard it on the research side of things, not just manufacturing, big pharma as well. And the big piece here, that as sophisticated as we are in the science, we take notes, hand notes, and we collect data in Excel sheets. And that's a huge barrier for AI implementation, which tells you it's moving fast, but it's gonna take a minute to come online, and it's gonna require more skills.
I have to then say quickly, I know this is one more question, and that comes back to inclusion, because you took me to the COVID, technically we couldn't be having this meeting 5 years ago because of COVID, right? So here we are having a meeting. But remember when the vaccines were coming out, and they said book an appointment. Well, you could book an appointment online if you had Wi-Fi. If you didn't have Wi-Fi, you couldn't. So remember, many neighborhoods didn't have access to the very treatments, right? And we saw high death rate, blah, 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 blah. So if we don't factor in the inclusion, just you said, there are some patients in rural areas, and not just big cities or inner cities, that don't have access to this type of technology to keep up, to have their data put into the system. So I think going in the future, it's like we want the patient's data in the labels of the drugs or devices they're using. We have to get them into the trials, which means getting them access to the very tools we're talking about, which is not impossible.
No,
And building trust with those communities.
And building trust, absolutely, and saying that science is not a bad thing.
Correct.
Yeah.
And we'll give you the last question, last word.
Oh, great. Thanks. Thank you, Rick, for your question. It was a great lead up to what I was going to bring up. If you look at the Industrial Revolution, okay, when that came over from Europe, across the pond, it took 90 years for that to really take full force in the United States, okay? AI and the transition to AI is exponentially faster. And one of my concerns is outside of the ecosystem that we are all a part of here is, and you talk about the minds of kids in school and what have you, and winning those over minds to a lot of the emerging technologies. However, I call it the big pivot. That I don't think we're really ready for the big pivot ready, in the sense of, say that there are 12,000 accountants in Massachusetts, okay? And say that 80% of them are over 30 years old. Okay, they're not gonna be going to school, they're not gonna be retrained, they're halfway through their career, so to speak, but how are we gonna get them, especially in Massachusetts here, to start getting ready and be pivot ready? Okay, because they're not in the science area, and there are a whole bunch of other groups also, that all of a sudden we're gonna have a major workforce crisis if we don't get pivot ready in some of the other areas.
You're goading me, Rick, because you know that I'm all about the deconstruction and reconstruction of higher education that's based on micro-credentials that can be stacked, and you don't need a degree to be successful in some pivot.
Right.
Yeah,
How'd you
I mean,
know?
I disagree in a certain way because we have to continue with, do I know anything about quantum a year ago? No, but I know a lot about quantum today. I've learned that I have to. So there is a condition called continuous learning that is upon us, whether it is not just limited to tech, it's to any business. You gotta keep learning as a doctor.
CLE, CME, I think the accountants have to be recertified, all of that, that's what I was going to say. When you have a professional degree, typically you have to take every year, or 2 or 3 years, you have to take a test, and you gotta keep up, and if you don't keep up, you don't have your licensure, so I think it's built in, and I can't imagine, well, I guess I shouldn't say that, but, I mean, if, for medicine, I mean, you were curious, you were a student, you're maybe a lifelong learner, I think it would be sad for that to end, to say, look, I've learned all I need to learn, and with this quantum thing, or this thing, I think, no. I don't know.
And the state provides a fair amount of support. You know, there are some, just like we support startups or manufacturer, we support the workforce as well, in the pivot to really, gain those skills, no matter where you are in your career.
I have to say this because you're good at Pathmakers. We have this program called Pathmakers, which you probably know about. So we take people who are usually using their hands, bakers, plumbers, mechanics, and we train them in biomanufacturing and medtech. And it's changed their worlds. They're already good with their hands. They didn't get a degree, they didn't get a DO or PhD or anything, but they've changed their lives. They've gone from sometimes $10, $12 an hour to $50, $60 an hour. And that's huge for their families, it's huge for their self-esteem, it's huge for them being part of this life sciences. We're number one, now they can be part of it.
No, I'll take the last word on that one before we close out, and thank you. Is really thinking about learning in a continuous and lifelong learning fashion. We've talked about that in our industry, my industry, which is higher education for a long time. We really haven't done it. We have to do it now. There's no choice to be competitive in the market. Also, to be a bit cranky, my kids are going to go to college. Great, if they come to Northeastern, it's free, but I'm not forcing them. $100,000 tuition bill.
Definitely force
Yeah,
them to go.
$100,000 tuition bill from other institutions is astronomical, and most people can't afford that. That cost has to be pushed to continuing education programs being funded by industry while people learn as they work. And with that, I'd like to thank you both for being with us this evening. It was a lot of fun. Not only a great conversation, but a great example of collaboration between two quasi-states and the AI and life sciences. We have food and drinks to mingle and ask questions. We're going to take a photo before I totally forget. And